experience with it, but it's something that I'm trying for my patients who are just not responding to anything else. And now I'm going to pass it to Tobias and see if he can enlighten me on what he does.
No, and I have to agree with Dan that in general, we also focus first on these three most common causes of chronic cough, and we make sure that since mesothelioma is a rare disease, common things being common, you still have to make sure that it's not one of these other three big players in the context of chronic cough. If that's not the case, the other important thing is to really make sure that the patients actually understand what cough means, and that cough actually serves a physiologic function, meaning clearing your airway, and that having the occasional cough is actually not necessarily a bad thing. So I really try to understand how debilitating cough is. If, of course, cough becomes debilitating to the degree that patients cannot go out and attend social functions and cannot sleep at night, these are the kinds of patients, if you don't find the cause of their cough, where you want to look for anything possible to try to alleviate it on an individualized basis, such as dealing with the pleural effusion very aggressively, or trying to eliminate other potential contributors. And if that's not the case, then we're pretty much down to symptomatic therapy. And Dan already pointed towards the gabapentin. Another thing that we've used on occasions, actually with quite some regularity, is actually just topical anesthesia, so nebulized lidocaine, to basically provide a numbing effect in the posterior throat, in the back of the throat, to try to break the cycle of coughing and trying to make people more comfortable. But similar to what Dan was saying, the problems with opiates, obviously opiates like morphine and other opiates, they suppress cough at a central level, at the brain level. And in this context, they can make people drowsy and can make people difficult to function during the day. Lidocaine doesn't do that, but of course lidocaine, if you numb up the back of your throat, it's pretty much like going to the dentist, and it becomes very hard to eat and drink after that, and without getting things down the wrong pipe and aspirating. So all of these things have their pros and cons, and if you don't find any of these big three causes, you're pretty much stuck trying to individualize therapy as much as possible after you determine that this patient really needs some help with the cough.
Oh, so I'm hearing vaporize, I'm thinking about medical marijuana now. So what about, people who are getting prescriptions for medical marijuana who have one lung or compromised lungs? How does inhaling these type of substances, does it affect the lungs? Does it hurt breathing?
To be honest, I don't have a lot of experience with that, so I guess in the state where I'm practicing, there's I don't think I think there's a way to get medical marijuana. It's not been really in my practice that much. I don't think that it would have a very detrimental effect on the lungs theoretically, but
it's important to understand that you don't have to smoke medical marijuana. That medical marijuana comes in a liquid form that can be put in foodstuffs, and that's how it's often taken. So it's hard to recommend someone who has underlying lung disease to smoke something that's going to make them feel better. They can take the same substance orally without injuring their lungs, because even though medical marijuana has clinical benefits, there are downsides to the lung to smoking marijuana, which are well proven. So I would recommend that if someone was prescribed, they lived in a state where medical marijuana was legal, that they get the oral form, however it is best administered, and not smoke the drug.
So Dr. Sturman, I'd be remiss if I didn't ask you about what's happening with your gene therapy trials, because I know you've been championing gene therapy for so many years. Where are we with those trials now?
Thank you for asking, Mary. We appreciate it. So we just completed, is that 5 minutes to go? Okay. Thank you, Melinda. That wasn't a 5 out of 10 for our performance so far?
That was 5 more questions.
Okay. I thought we were up at 5. I thought we were up at like at least 8.5. We're doing really well. So we completed at the University of Pennsylvania I think the largest gene therapy trial ever in mesothelioma just this past fall. When I say completed, we enrolled the last patient. We're still following many of the patients in the clinic. And this was 40 patients, started in March of 2011. We finished in 3 years. We're summarizing our data, and we'll be submitting it, presenting it at the International